The coronavirus pandemic continues to rapidly spread around the globe, with tens of thousands of people being diagnosed with the disease every day. At the front line of this pandemic, nurses and doctors serving their patients. These medical professionals are not only battling the virus, they are continuing to support the everyday needs of their communities. To understand how medical professionals are fighting the pandemic while serving their community, I am joined by Dr. Farhan Bhatti, the CEO of Carefree Medical. Dr. Bhatti, thank you so much for joining me today.
Thanks, Chris. Thanks for having me.
It's our pleasure. So, Carefree Medical offers medical, dental, optometry, and behavioral health services to uninsured, insured in the greater Lansing community in Michigan. As we talk about that community, I'd like to just start by discussing the public health approach and get your thoughts on how public health and government officials are supporting frontline medical professionals in this time of crisis.
Sure. So, first of all, I want to thank Governor Whitmer and governors across the country for their advocacy on our behalf. They are working day and night to make sure that we have the supplies that we need to do our jobs and to keep ourselves and our patients safe. You know, one of the biggest things that they've done is just raise awareness in the public that we don't have enough ventilators, that we don't have enough masks. And this wasn't really on anyone's radar a month ago, but it is now, and that's thanks to the work that the governors are doing. So I'm grateful for their leadership, and there's more to be done. I am also grateful for the work that's happening in Congress right now. Just yesterday, the Senate passed, and the House and the President will soon pass and sign a $2 trillion stimulus or recovery package. And included in that package is $130 billion that will go towards hospitals and healthcare providers. And that money will be used to keep hospitals open because a lot of hospitals are losing money right now as they've had to retool themselves to take care of all these patients with coronavirus. And so that money will help keep our hospitals open. And it will also help us receive some of the supplies that we need, the ventilators, the masks, etc. But it's still not enough. If you look at the state of New York, they're going to need more ventilators than even will be supplied by the new legislation. So I'm optimistic that Congress will continue to address this issue moving forward so that states that are the hardest hit will be able to receive more supplies.
Well, you mentioned New York, and Governor Cuomo is obviously asking for 30,000 ventilators for that state. And it's wonderful to see what we have here in our own backyard, Michigan, some of the automakers, GM, Ford, stepping up to try to retool their supply lines and production lines to produce some of that essential medical equipment. But as you say, it's just not enough, quick enough, probably.
Right, and so that's the whole idea behind trying to flatten the curve is to try to delay the number of people that get this and how rapidly this spreads in the community. And that delay will give time to our automakers, Ford and GM, who, you know, it's a very heartwarming thing that they decided on their own accord to work with their suppliers to make these ventilators. But, you know, that's still probably 2 or 3 months away before we see any fruits of that labor. And so anything that we can do to try to delay how fast this spreads will allow us to, you know, continue to get those supplies 2 or 3 months from now.
You mentioned Governor Whitmer, and she has, and as you said, tirelessly out in front of this issue. State and local leaders like Governor Whitmer in Michigan have ordered shelter-in-place orders to help stop the spread of COVID-19. What signs are you looking for that the measures that she has put in place and other governors have put in place are working?
Well, if you look at the state of New York, for example, the number of people that are becoming infected from coronavirus is doubling every 2 to 3 days. And so what I'm looking for is for that number to first start to space out, so maybe doubling every 6 days or every week or 2 weeks, and then eventually to have it be that the numbers are simply not increasing any longer. So, but as long as we continue to see the number of people being infected rise this rapidly, this exponentially, then that means that we have to continue to shelter in place. What we're trying to accomplish by keeping people in their homes is to try to reduce how fast this virus is spreading in the communities. And if people continue to do such a good job with cooperating and listen, government leaders, if people continue to do their part, then we'll be able to see that rate slowly start to diminish over time. But as long as that continues to climb, then that means we've got more work to do. And the challenge, the unique challenge that we have is that because the number of tests is still limited, we don't really have a full grasp on how quickly that number is actually increasing. We know that in Michigan, there's about 2,300 confirmed cases of coronavirus, but that's just among the folks that have been tested. And we know that this virus is spreading in the community. And so predicting how fast it's spreading is a challenge for all of us. And right now, it would just be way too soon to end the shelter in place. In fact, much of the country is still not even has not even begun the process of sheltering in place, and that's an area where I'd like to see more leadership from the federal government to have a nationwide shelter in place order for at least 2 to 4 weeks to allow us to try to contain the spread of this disease as quickly as possible.
Well, you mentioned that maybe the federal government needs to step in and expand that shelter in place. You've also mentioned the stimulus package. Are there any additional steps you would like to see government leaders, either at the local, state, or federal level, take to help combat the pandemic?
I would like to see our federal leaders take this more seriously as it pertains to the spread of the disease. I know that many leaders in Washington are yearning to get the economy moving again, and we all understand that. I mean, I also, as a CEO of a nonprofit business, I'm facing the difficult decision every day as far as should I have my employees continue to come in? Should I furlough half of them? Uh, and so I understand the need and the desire to get the economy moving, but what's more important is for us to keep ourselves and our families safe and secure. And so I would like to see our federal leaders shift their focus more towards public health. And, we will get to the economy in a few months, hopefully, but, there will be nothing to come back to if the workforce comes back too soon and then gets infected with the disease, and then our hospitals become overrun with people, and we're facing tough decisions on who to ventilate and who to let die, essentially, because there's not enough ventilators. So trying to get people to go back to work too soon, I think, is short-sighted, because ultimately people are going to be calling into work sick as they begin exposure to other people that are infected. And ultimately, we're not going to be receiving the kind of economic recovery that we're hoping to receive if we end our isolation abruptly.